Hello, and welcome to Ask Dr. Dora. I'm Dr. Dora Dixie, board certified in family medicine and addiction medicine. Ask Dr. Dora Podcast is my virtual medical ministry that is all about addiction medicine, substance use disorders, and the magnificent bodies we live in, where I always say knowledge is power. The more knowledge we have, the more power we have to make positive changes in the world we live in. Today, I will discuss epidemiology. It's a big word, and I learned it in medical school. It means to examine the relationships between the occurrence of and environmental influences of a disease. Epidemiologists are not medical doctors. They are public health professionals or detectives who study disease outbreaks and health threats, focusing on understanding the causes, the incidence, distribution, or spread of diseases and other factors relating to health. They work in research policy development and public health policy. Some words to understand are incidence. Incidence is the number of new cases that occur in a population over a specific period of time. And prevalence is the measure of the proportion of the population that has a disease at a specific point in time. So let's go into the epidemiology of substance use. Substance use morbidity and mortality are increasing across nearly all classes of substances and populations. In 2022, of people 12 and older, 16.5% reported using an illicit drug in the past month. Let's talk about epidemiology of substance use. Substance misuse, morbidity, and mortality are increasing across nearly all classes of substances and populations. In 2022, people 12 years and older reported 16.5% using an illicit drug in the past month, and 22% had at least one episode of binge drinking. So we're all on the same page. Binge drinking is defined as 5 or more drinks for men and 4 or more drinks for women on one occasion. Drug-related overdose deaths have risen 500% since 2000. There have been at least 100,000 deaths annually since 2021. Let's move on to alcohol. The National Institute on Alcohol Abuse and Alcoholism attributes approximately 95,000 deaths per year to alcohol use. And of all the automobile deaths, 28% have alcohol involved. Moving on to benzodiazepines. When benzodiazepines are combined with opioids or alcohol, the potential for overdose increases significantly. Cannabis, as of November 2023, for recreational use was legalized in 24 states in Washington, D.C. and Guam. Because it is legal, there is growing social acceptance for its use and growing use. In 2021, cannabis was reported in 18.7% of the United States population, and 5.8% had developed a cannabis use disorder. A commonly reported misconception is that cannabis is not addictive. The potency of cannabis has increased sharply over time, and newer formulations of edible cannabis and cannabis extracts, which are vaporized or smoked. Smoking or eating cannabis can result in increased unwanted side effects, including cannabinoid hyperemesis syndrome. That is where chronic users of cannabis develop nausea and vomiting, and they cannot stop throwing up, which requires them to be hospitalized for several days to control the symptoms and to keep them from getting dehydrated and die. Although cannabis-related emergency department visits are increasing, no overdose deaths have been attributed to cannabis use alone. Beginning in the early 2000s, opioid manufacturers promoted misinformation about the safety of prescription opioids, initiating the overdose crisis from within the healthcare industry. Despite policy and prescribing patterns shifting away from opioid overprescribing, overdose deaths have accelerated as use shifted first from heroin and then to more potent synthetic opioids like fentanyl. The increasing availability of synthetic opioids in unregulated markets goes hand in hand with skyrocketing overdose deaths. Deaths from stimulants, for example, methamphetamine and cocaine, have increased fivefold in the past decade to more than 53,000 in 2021. Socioeconomic status is strongly linked to substance use vulnerability, emphasizing that broader social conditions must be addressed alongside clinical interventions. Living in high poverty areas corresponds to higher rates of overdose deaths and addiction. Neighborhoods with over 30% of residents living below the poverty line may see double the overdose fatality rate compared to affluent areas. Individuals without a high school diploma are more likely to experience substance problems. By contrast, college graduates have the lowest prevalence of addictions. Roughly 17% of unemployed adults struggle with substance use disorder, nearly twice the rate of those employed full-time. This data suggests that multi-pronged approach, improving access to education, employment, and stable housing can reduce substance use in vulnerable communities. Here is something I want you to think about. In Chicago, the incidence of opioid overdoses has seen significant increases in recent years. In 2022, there were 3,200 opioid overdose deaths. That is 2.7 times more than car crash deaths and 2.5 times more homicides. Additionally, there were 7,300 opioid-related emergency room system responses. There are indications of a decline in opioid-related deaths in 2024. The federal administration wants to send the National Guard to deal with the homicide problem when opioid overdose deaths is 203 times higher than gun violence, and ambulance responses is 6 to 7 times higher for overdoses than for gun violence. I suggest that Chicago needs more treatment dollars for what is really killing people in the city. Search the CDC, the National Institute of Health, Departments of Public Health websites for your city and increase your knowledge of epidemiology where you live. Thank you for joining me. Do you feel smarter, more informed, and want more? Subscribe to Ask Dr. Dora Podcast on YouTube and watch every episode where my motto is, knowledge is power. Thank you for listening.